Dr. Jaffe, how would you respond to someone who is reluctant to have their blood drawn, having a concern of a viral infection?
Well, there are people who are queasy about having blood drawn. There are people who've had adverse consequences of blood draws. I do recommend that you always ask people if they have any concerns about having an ounce of blood, tiny amount, drawn. And if they say, well, I fainted last time I had blood drawn, you can recommend that they lie down while the blood is being drawn. I urge people to look away and see themselves in the circumstance that evokes their healing responses, because backseat drivers are not needed, and you do not need to watch the blood as it goes into the tube. In fact, it's better off if you don't. So I'm not quite sure what the question is. I know the amounts of blood we're talking about are small and replaced by the bone marrow in human beings in a matter of hours. So it's a small amount of blood. I know that many people are concerned until they understand. And once they understand, then they know that many, many thousands of people every day have blood samples obtained, analyzed in laboratories, and results returned. So if you've had an adverse result, like I got lightheaded or fainted, well, maybe you should lie down while the blood is being drawn. And on the other hand, if you're just an anxious person, maybe you should take a few deep breaths or practice abdominal breathing or the green dichromatic light or the salt and soda bath to the point where your anxiety does not overwhelm your good sense. So I'm not quite sure what the question is. If it's about anxiety, we would want a relaxation response. If it's about any concern about you being contaminated by a blood draw, so there's nothing being injected into you, it's just a blood sample being taken, I can assure everyone that there is zero chance that you will get an infection from a blood draw. Now, if you're an immunocompromised person with leukemia, we might want you to be on protective antioxidants, buffering minerals, essential cofactors, and so forth. That's a whole different category. But I think the question is about people who are just anxious, and we need to help them both understand and relax so that we can do our job, which is helping them restore tolerance, resilience, neurohormonal balance, and good health.